All right. I'll start by introducing myself. I'm Dr. Chaya Murali. I'm a pediatric geneticist at Baylor College of Medicine, and I've had the pleasure of working with the TANGO2 families for several years now. I'm one of the stakeholders, the PCORI stakeholders for the TANGO2 group, and I'll give you guys a chance to introduce yourselves first.
We are the parents of Hannah Mitchell, who has TANGO2, and she is 29 years old. I'm Bob.
And I'm Robin, and we live in Michigan, United States of America.
All right. Well, great to meet y'all officially. So I think our first question will be, tell us where Hannah's TANGO2 story starts and how did her symptoms progress?
Yeah, Hannah's TANGO2 story really started when she was about 18 months old, when we witnessed her first spell. She started to have spells at 18 months. We didn't know what they were. It was very scary. She continued to have those spells from the age of 18 months till she was 6, probably about 4 or 5 times a month. Nobody knew what they were. We took her to pediatric neurologists. They didn't know what it was, thought it was maybe episodic ataxia.
Tell me what those spells looked like a little bit.
The spells looked like she was drunk. She would fall over, lean to one side, fall over. She would be unable to walk. In the early days, she wasn't talking anyway, but she would start to drool profusely. And then as she got older, she couldn't talk when she was having the spells.
I see. Okay. And I'm sorry, you were saying they thought it was episodic ataxia, and then kind of what happened from there?
From there, she also had some additional symptoms. So starting at age 4, she was not diagnosed, but we took her to the school system. She was identified as being pre-primary impaired. So she started special education services through our school system at age 4. She continued through age 26 here in Michigan. We can have special education through age 26.
Oh, great.
She also, let's see, the other symptoms that started happening is when she was 4 years old, she had amblyopia. She had to wear an eye patch for about a year. That seemed to clear up at some point, maybe about a year later. When she was 17 years old, she started to have seizures. We witnessed her first seizure at 17. She started on anti-seizure medication. She only had maybe 1 or 2 seizures a year, but that was scary as well.
Oh, I'm sure.
And then ultimately, again, we didn't know what was causing all these symptoms. Her doctors didn't know what was causing these symptoms. Whenever we would talk to a new doctor, a new primary care, or a new neurologist, or a new teacher at school, we would just tell them that Hannah sometimes had these episodes or spells where she would fall down and couldn't walk and she'd start to drool. And we said, just sit her down in the corner, let her relax, it'll pass. So that's for 27 years what we did until the crisis happened.
Wow. So tell me about this crisis. Must have happened about 2 years ago.
Yes, the crisis happened 2 years ago. At that point, we still didn't have a diagnosis, but Hannah was, there was some stress in her life about 2 years ago. She was going to a new vocational program. Her dog died. Her brother graduated from college and moved away. So things changed and she was under a little bit of stress. She started at age 27, even though we had not seen the episodes for years, they started to come back. Once a week, twice a week, for about 3 months, she started having the spells again, which was scary. We didn't know what was going on.
Yeah, and the recovery time seemed to last longer and longer and longer. So there was this progression of more frequent and more intense.
Right. And so we took her, we asked the neurologist, what do we do? We had some labs done, and it looked like her AST and ALT, her liver numbers were high. So then they didn't know why that was happening either.
Yeah.
She came home from school the day before her crisis. She had a seizure on the bus coming home from
Mm-hmm.
school. We had to carry her in the house. She wasn't doing well. She was melting.
Mm.
That night, she just didn't do well. We took her to the emergency room the next day. And that's for the next 30 hours, she just continued to go downhill.
Tell me what
Yeah.
you mean by she was melting. I'm sorry, I cut you off, Bob.
Okay.
Yeah, no energy. She
Mm.
couldn't hold her head up. Her neck would flop. She couldn't
Wow.
talk. She couldn't walk. We had to carry her to the car. Probably should have called an ambulance, but we actually took her to the 30 minutes down the road to the University Research-based hospital where she received her care, and they didn't know what was wrong with her either. They thought she was just, it was a post-seizure, and she was just still recovering. So they didn't know what was wrong with her either. They put her on the observation floor, admitted her on the observation floor, and observed her for about 30 hours, but she continued to go downhill and lactic acidosis. And finally, when they realized that she was in status epilepticus, she was
You got
having
it.
seizure after seizure after seizure. She
Yeah.
had lactic acidosis. They realized they needed to urgently intubate her and send her to the neuro ICU,
Oh my
where
goodness.
she had a run of SVT,
Yeah,
supraventricular tachycardia.
that's exactly right.
And things were really bad. She had a pulseless VTAC
Wow.
and received defibrillation. She received hemodialysis to get rid of the lactic acid. It was bad for a couple days. They didn't know what was wrong until they brought in the pediatric geneticist.
Oh,
That's when things turned around.
Yeah, they described Hannah's symptoms and history, and we were fortunate enough that they were talking to someone who had, I think at the time, 4, maybe 5 other Tango patients, and they said, sounds an awful lot like TANGO2.
wow.
Start doing this, and I'm convinced that phone call saved her.
I'm
So
sure.
we got very fortunate that the folks that were talking to one another, they reached out to the right department and got the right person, and we were very fortunate for that.
Thank goodness. So then, tell me, when did she get the actual diagnosis?
Yeah, she got the pediatric geneticist immediately suspected TANGO2 because everything sort of fell in line. And we had whole genome sequencing done, and we got the definitive diagnosis 2 weeks later.
Okay, I see.
Hannah was still an inpatient.
Okay, okay. Now, what are your hopes for the future? You know, you've been through all that you've been through. You know, what do you see in the future? What do you hope for?
Well, I think for me, I think the big scary thing going forward is Hannah's 29, and she's among the older Tango two folks that we have in the community. And one of the things that came out of our visit, it didn't come to me immediately, but one of the things I suspect is that an ileus is what actually got us to the point of crisis. I'm looking forward to understanding more about gastrointestinal health, and I think communicating the importance of it. It's something that it seems in retrospect blindingly obvious, but you have an older child, understanding what goes in is easy, what comes out isn't so easy. In looking at what an ileus is, it kind of matched her symptoms. When she was in the ICU, they mentioned it was kind of in passing that she has an ileus, and that's what was keeping her there before she went to the step down area of the hospital. And in reading about that, it did look a lot like those can last for months. They can come and go, and they can last for months. It's not as simple as just being stopped up. And Hannah, for 3 months, was on a downhill slide, and I really suspect that ileus and the gastrointestinal part played a really big part in why we ended up in the hospital.
I see.
Known better, I think we would have been watching that much more carefully as we do now.
Sure. Yeah. Now, we talked a little bit about what you're hoping for in the future, but right now, how is Hannah doing?
Hannah's doing great. She is healthy. She's on B vitamins. She has been on B vitamins now for almost 2 years. She
Mhm.
hasn't had a spell, an episode, a seizure. She's very happy and healthy. And she's also on Miralax every single day.
I was going
So
to ask.
she's staying regular and eating healthy and exercising and drinking lots of water every day.
Yeah.
Very happy.
Yeah, we're really focusing on the hydration part and the food part, as well as, of course, the Miralax that
And the B
Robin
vitamins.
and B vitamins. So I think we can't tease apart all the things, all their contributions, but I think every single one of them has played a part, and certainly the B vitamins, but also the attention to the gastrointestinal stuff. I think is
Yeah.
really important.
Now tell me, is she on any medications to prevent seizures, or is she on any medications for her heart?
Yes, she's on Keppra. She's been on Keppra, first Lamictal when she was 17, and then we moved to Keppra. So yes, she takes Keppra. She was on Nadolol because they suspected long QT, but her QT is actually short. So we stopped the Nadolol about 2 months ago. But
Okay.
She also had a ICD placed when she was at the hospital, which is, they did that, I think, out of an abundance of caution. It's not clear that she really needs that at this point. But it's there, and it's a backup, I suppose.
Yeah, exactly. Well, thank you so much for answering some of those questions. And I'm really glad to hear that, you guys have an answer now and that Hannah's doing so much better. And I can see that she's very happy.